Brown, all the chairmen here. Senator Whitehouse.
Secretary, nice to see you again. And Senator Weiss, thank you for your work, especially on Alzheimer's. We also appreciate that. Secretary Becerra, as you know, the Norfolk Southern derailment in East Palestine, I was there again yesterday, has left many community members with questions. They want to know how the toxic exposure they and their loved ones experience will affect their health. It's important in the process of searching for and receiving answers about these effects, their concerns are taken into account. I know some of your agencies have been there since the very beginning. And you're aware of that, of course. Thank you. I know that moving forward, HHS will be heavily involved. Yesterday, one of my trips back to East Palestine, I visited the mobile health clinic, set up partially funded by HRSA. People are still coming in seeking help for symptoms related to exposure, and of course, they fear for the future. People are frustrated, they're scared, they feel like time is of the essence. They're afraid when the cameras leave that the help leaves. Can you assure me that HHS will continue to move with urgency in response to this disaster?
Senator, we were there from the beginning. We're not leaving, and we've been on the ground. And as you said, we've also provided resources, for example, to that community health clinic.
Thank you, and I know that even though the president didn't go right away or you didn't go right away, that your people were there and made a real difference. Thank you. I want to talk to you about drug pricing briefly. One of the victories of the Inflation Reduction Act was capping Medicare copay for insulin at $35 a month. Walk through what that means for an average Ohio senior who needs this life-saving drug.
For the average Ohio senior, it's probably about $500 they get to keep in their pocket. $500, just like that. Because before they were paying $100 for that insulin a month, some paying up to $150, $200 a month. But on average, so some will save much more, some will save maybe a little less, but on average, every senior in Ohio who needs insulin, $500 extra in your pocket this year. By the way, if we had done this last year, that would have been $500 last year you would have kept in your pocket. The year before, there's no reason why a drug that we know costs no more than about $10 to manufacture should be costing seniors $100, $200.
Thank you. That was said so very well. Thank you. Switch gears for a moment. My last question, Mr. Chair. I know there's a vote. Talk about Medicare Advantage, a great program that serves millions of beneficiaries well. I'm concerned some seniors overpay and aren't receiving the benefits they deserve. Some Medicare Advantage plans misrepresent how sick their patients are to CMS in order to take more money from taxpayers. MedPAC says without fixing this, taxpayers and seniors will be paying billions of dollars more than they should be. MedPAC estimates it costs us over $20 billion in 2023 alone. Seniors are literally paying for this in the form of higher premiums. Fixing this sounds like a great way to save money, but I keep hearing that saving this money that is bad, that it's going to hurt our seniors, put them in danger of having their benefits cut. Explain to me why that's just not true.
Well, Senator, it's not true because there is nothing that we're doing in this advance notice that would require any insurer to cut Medicare benefits. In fact, they remain the same. Those benefits must be provided by law. What we do is we take out that extra charge, and we're going to try to get back some of the money that we were overcharged as a Medicare program that should have been used to provide more services to Medicare recipients. And so we think it's the right thing to do to make sure that every dollar that someone paid in when they were working and saw their deduction from their paycheck is used to provide Medicare once they are retired, not to help line the pockets of those who are overbilling. And we're going to go after any overbilling where we can.
Good. I know you will, and your record is that. So thank you, Mr. Secretary. Mr. Chairman.
I thank my colleague. Before he leaves, I just want to say thank you to Senator Brown, and then we'll go to Senator Young, because he remembers in 2019 when we were in this room, and we weren't going to be able to get everything we wanted in that bill. And we came up with an anti-price gouging strategy to protect consumers. And just this week, we saw the fruits of it, because the administration announced lower co-insurance payments for 27 drugs in Medicare Part B as a result of the penalties for price gouging. And you see it particularly with drugs like Humira, which is sort of a poster child for why you ought to have more bargaining power. So in this room, Senator Brown was incredibly helpful with that, and I want to thank him.